Hey guys, my name's Elicia. I'm a business coach for massage therapists and the owner of Massage Champions. One of the things that we talk to our clients about is how to grow. Often our business is a reflection of us, and if we want our business to grow, if we want to be able to see more clients, make a bigger impact, then we've got to be willing to work on ourselves. Now, this is often described as getting outside your comfort zone. But here's the thing, not many of us like to get outside our comfort zone. What we actually like is to stay comfortable, and we do a lot of work in our culture to actually stay quite comfortable. But we know that that's not where the growth happens. Growth happens on the outside of our comfort zone. Now, if you imagine that there's a circle and that is your comfort zone, and just outside of that is the stuff that kind of scares you a little bit, and then you've probably got a bunch of stuff that's like really, really terrifying right out that you don't even want to think about. The only and the quickest way to grow is to literally get to the edge of your comfort zone before you step out and start to grow. So you do something that's uncomfortable. But I've heard this called something else that makes it a little bit more least likely that we want to actually stay in here, makes us want to grow. Because the problem is, if we stay in our comfort zone, it actually kind of sounds like the death zone. Because if we're not green and growing, we're ripe and rotting. If we're not doing stuff that challenges ourselves, we tend to get stagnant and stale, and we stay the same. So if you want to get outside of your death zone and start to increase your sphere of influence, being able to go to the end of that death zone and step over it into something that scares you a little bit is the biggest and best way to grow. One of the challenges that we set for our clients is often a 30-day Facebook Live challenge. Now, this is twofold. Number one, it's great for marketing, getting yourself out there, but it's also a great tool for those that are on social media to start to do something that will challenge their death zone massively, get them right outside their comfort zone, and they have to get up every day and talk about their business, who they help, why they exist, the knowledge that they have, and share that. And what we usually find is the first probably 1 to 10 days is literally they are living in the death zone and they are freaking right out. And all of a sudden they have some sort of breakthrough where they go, oh my goodness, maybe I do actually know my stuff. Maybe the stuff that I know isn't what everybody else in my community knows. Maybe I do actually have amazing gifts and talents to give to the world. And simply by stepping out of their death zone into their growth zone, what happens is their comfort zone becomes bigger. What they find easier to do becomes bigger, and they can be comfortable in more areas of their lives. And that means that they get to do more exciting things to be able to move out into their growth zone even more. What is it that you need to do this week in your business to be able to grow your death zone so that you want to be able to grow and actually impact and create a change in more people's lives?
How do I change associations? Making the decision to change associations can be a difficult choice. Some questions you might ask yourself: are my current association's values the same as mine? Do I get what I need for my business and career? If the answer is no, then maybe it's time to join Massage and Myotherapy Australia. You can find a list of qualifications the association recognises on massagemyotherapy.com.au/join-now. To join, download an application form via the Massage and Myotherapy Australia website. Include in your application a list of your current active provider numbers. There may be a slight disruption when your previous association cancels numbers. If this occurs, contact us as soon as possible. If you include evidence of your current association membership, Massage and Myotherapy Australia may provide you with a discount. Don't hesitate. Join Massage and Myotherapy Australia, the Association of Professional Therapists.
Hey folks, Dave Sheen here from Connect. I've got Robert Nardis here today from GemT. Welcome, Robert.
Thank you very much, David.
Firstly, just a starting point with a lot of the interviews, just a little bit about your background and how you got involved in dry needling.
Sure. So I'm a physiotherapist. I'm fortunate enough to run a large multidisciplinary clinic in Sandringham. We've got physios and osteos and everything in between. As for dry needling, it was something I dabbled in years ago, but I really got introduced to it when I was actually in the States lecturing on whiplash, and I was telling people that I love to read on a plane, but I always get a headache.
Right.
Next thing I knew, I was lying face down and some crazy American was needling off my C2, rectus capitis posterior major, and I got a twitch response, and I thought, what the hell was all that about? but I was able to read as much as I wanted to on the way home without a headache.
Sure.
And I thought, I've got to know more about this.
Yeah, yeah.
So I then explored the country and explored internationally, and did a number of courses. And then I just saw, I've always been an educator, and I saw an opening and a need to run high quality courses, and that's what we've been doing for the last 12, 13 years.
Absolutely. Well, I'll just explaining to Robert a little bit about the Connect show and how one of the previous episodes I interviewed Paul Buffle in Saskatoon, and we were talking about regulation over there. So in fact in Canada we are very fortunate here in Australia that we have educators that are able to educate people up on dry needling, because it's not part of the scope over there in Canada. So did you want to just explain to people, just summarise what the dry needling is?
Sure.
Yeah.
Look, dry needling is, I think most therapists understand the concept of trigger points and how trigger points contribute to myofascial pain. And there's many ways you can have an impact on a trigger point with manual techniques. Dry needling is the application of, it's dry because we're not injecting anything.
Sure.
It's what most people know as an acupuncture needle, because when it's in the hands of a dry needler, it's a dry needle. So we use a dry needle to have an impact on a trigger point. So it's literally, it's an invasive technique. It's literally the insertion of a needle where a trigger point exists, either active or latent trigger point.
Sure.
And then when we manipulate the needle in order to get a twitch response.
And the safety aspect is probably a big part of what you teach in your courses as well?
Without a doubt, we make no exceptions and we make no apologies. And we run, we believe, the safest course going around. We spend a lot of time explaining to our delegates that we have to protect the most important person in the room, which is the therapist. And dry needling is a procedure. So I recently had a lot of dental work done, and many hours in the chair, and quite a lot of money as well.
Yep, no doubt, absolutely.
But I never once saw a syringe, I never once saw an implement, because dentists know how to perform a procedure. Typically, manual therapists, not so much. So we spend a lot of time explaining how we set up everything from a needle trolley, how we wear gloves, and the patient actually never sees the needle. It is really a needle procedure that is designed to protect the most important people, which is the therapist and then obviously the patient.
Absolutely, okay. And as far as the courses that you run, are they specific to, I mean, we're probably going out more to remedial therapists, myotherapists, and bachelor's musculoskeletal as well. So your courses are sort of adapted for those, for that client?
Yeah, we spend a lot of time working with your association to gain accreditation. It's a 60-hour course.
Okay.
There's 3 online modules which cover theory of dry needling, the history of dry needling, safety aspects and anatomy. At the end of each module there is an online multi-choice question, non-threatening, but it just ensures by the time we hit module 4, which is the practical, everyone has reached a certain standard. You get 2 attempts at the tests, by the way. And then by the time we get to modules 4, 5 and 6, which are the practicals, we know everyone's reached a certain standard.
Cool. And as far as benefits, so benefits for clients, I mean, I've heard you speak before and you talk about how it's the one tool in the toolbox that you just find, you know, is the go-to. What about for therapists? So what advantages does a therapist have if they've got this as their tool? And from a patient-client point of view, what benefits do you think hold true for them? Is it a fast response? Like what sort of things do you think are beneficial towards the dry needling?
Look, we've had discussions about this before, and I've been a therapist for nearly 30 years now, and without a doubt, the greatest rewards I've ever had is using a needle in my hand. You know, the stories I could tell you, the one that always comes to mind is a 24-year-old girl who could only open her mouth 17 mil, which is not very far.
So that would have been a TMJ issue? Or?
TMJ issue. It's called trismus, an inability to open your mouth. Referred to me from a dentist because of dental hygiene issues, but the social issues that come with only opening your mouth 17 mil. She has not been out to a restaurant for 4 or 5 years, never been on a date, didn't eat in public. Okay, so she was very embarrassed by her condition. Sure. After 3 treatments and needling muscles such as masseter and lateral pterygoid, we got her out to 30, 32 mil. So to see as we say, the person come out of the patient, now being confident to walk down the street and eat an apple, to be confident to go out socially. So to have that sort of impact on someone is obviously very rewarding, and the reasons why we are therapists. So from a therapist's perspective, it is a very timely and efficient way to make a difference clinically. We talk about on our courses to always set yourself up to be the expert in the room. And everything from just being really specific with your application. So yes, it does save your wrists and thumbs without a doubt, because you only need your fingertips, but it just makes you so much more clinically specific, and that's what we love about the course. From a patient's perspective, like everything, not everyone responds to every manual technique.
Sure.
I would say a quarter of my patients love it and come in and ask for it. Then there would be, the bulk of them would say, Robert, I wish there was another technique that was quite as effective as this, but go ahead and needle me, okay? Because they know it just gives them the best result. So it's an unusual sensation. It's nowhere near as painful as me driving my elbow into your glutes. I'll give you the tip on that.
Yeah, for sure.
But the twitch response which we need to get is just an unusual sensation. But as long as you prepare your patient for that, there's very few people that decline dry needling, because more and more of the public are actually demanding it.
If people at home are interested in looking up a little bit more about dry needling, many therapists know about Travell-Simons,
Yes.
but there's also the other theory that surrounds the efficiency or the efficacy behind dry needling. So what was the other?
Yeah, there's probably two main models. You're right, Travell and Simon, which is a straightforward trigger point model, which is very effective. There's a model put forward by Dr. Chan Gunn, and going to his website, which is iStop. If you look up iStop on the internet, you'll go to his website, and he talks about a slightly different application of dry needling. At the end of the day, it's just variations of a theme. And our course combines both their models and also ties in with some recent research that shows the impact and the chemical changes that occur in the body following a twitch response.
Okay, great. And as far as your courses, you've been travelling around the world with them as well?
Yes, look, being very lucky. We lecture throughout Australia, New Zealand. We've done the US as well. We're now working well into Malaysia. And look, our company's called Global Education of Manual Therapists, and I will say probably the highlight for us last year was we trained up some people in Malaysia to run our courses, and they were able to run a course in Cambodia for us. So Cambodia wanted to get us across. The average salary for a physio in Cambodia is $7,000. They couldn't even afford our airfares. But our Malaysian instructors were able to go across. So we have some certain things on our professional bucket list, and bringing quality education to underdeveloped countries, we're really proud to achieve that.
Okay, fantastic. And Robert will be at 2020 National Conference also in Glenelg at the Stanford Plaza, which will be in May next year, May 2020.
Yes.
So you can catch up with Robert there as well. Conference committee are still out at the moment as far as presentations, but you have taken a booth, I believe, already.
Yes,
so,
we're an exhibitor.
So come and see Robert there if you want to learn more about myofascial needling. Robert, thank you very much for being on board for Connect, and we'll see you guys next time. Thanks a lot.
The client should be facing you. The draping should cover from the client's shoulders to at least the knees. Place a pillow under the client's head. Massage the bent leg only from this position. Ask the client to straighten the leg that is on the table. The top leg should be bent at the knee. Place a pillow under the bent knee. Tuck the draping in between the pillow and the front of the knee. Then, whilst loosely holding the draping at the back of the knee, fold the draping upward, tucking the edge into the leg band of the undergarment at the hip. Then tuck the draping between the pillow and the back of the knee. On completion of the massage, recover the leg.